Good evening. Welcome. Good evening, Mr. Franklin. And I'm very happy that you are here live. Do we need a recap from yesterday? Does everyone remember what we spoke about? That's why I wanted to have the sessions very close to each other so that nobody forgets. Not really, right? It's pretty fresh in the memory. Happy Sunday. Okay, so let's begin. So as always, I would never call you to text to inform you about my Zoom sessions, please. Okay. Please turn on your two-step verification. I work alone. I'm not working with anyone. If I was, I would have introduced them to you. Okay. So please don't listen to anyone who calls you saying, Rita is hosting this session. I will send the link to you. I will send the code to your device. They're just trying to hack into your WhatsApp account. Okay. So please let's not fall victim. All right. So yesterday we spoke about cholesterol. We spoke about so many things concerning cholesterol. And the breakdown of all that is cholesterol is not something to be feared. Cholesterol is not something that causes heart disease. It simply shows up, when we have the root cause, okay, of what causes heart disease, which is oxidative stress and homocysteine. Okay, so cholesterol is like a symptom, okay, that shows up. And the reason it shows up is that your body releases cholesterol to go there and, heal that place. But unfortunately, some of it gets stuck in there, and then your immune system will try to get it out, and both your immune system and the cholesterol will get stuck there together. Okay. So we spoke about a lot yesterday, but today we're going to get into some very important information, like saturated fats. Is it healthy? If our cholesterol view is shifting, that means that we also need a shift in the way we view saturated fats and unsaturated fats, right? Does eating fat make me fat? What about LDL and HDL cholesterol? What's the deal, about these types of cholesterol? And then we are going to look at a blood test together, okay? So I hope that you are up for a little mathematics tonight. So we're going to look at somebody's, just an example anyway, okay? Someone's lipid profile, okay? And we are going to examine it together. All right. And then we're going to talk about how you can pinpoint if you are struggling with heart disease already. That means if you have some plaque in your blood vessels already. And we're going to talk about the best indicator, okay, for that. So let's begin with types of cholesterol, okay? LDL and HDL cholesterol. Now, from what we know at this point in time, we see LDL cholesterol as bad cholesterol, right? And we see HDL cholesterol as the good cholesterol. Now, let us break down the meaning of LDL and HDL. LDL means low density lipoprotein, okay? So LDL is actually an abbreviation for low density lipoprotein. And then we have HDL, which means high density lipoprotein. And what do we mean when we say that something has a low density? It means that that thing has more space, right? It means that it doesn't occupy much space. So you can still put in, it can still carry some more particles, right? And when we say that something has a high density, that means that that thing has little to no space, okay? So now we know what low density and high density means. Now, what's the meaning of a lipoprotein? A lipoprotein is something that wraps the cholesterol for transportation in the blood. All right, so let's take a look at this photo I have here. This is a picture of something that has a substance that has high density. You can see the particles are very close to each other. There isn't much space here for you to fit in anything. All right. And if you look at the substance that has low density, you see that it has lots of space in between this substance. The particles are well spread out, so you can fit in, you know, more particles into this substance that has a low density. And then a lipoprotein is what wraps the cholesterol for transportation. Okay, that's what puts that's what houses the cholesterol so that the cholesterol can then travel in the blood. All right, so I hope that we know now what low density lipoprotein is and what high density lipoprotein is. Okay, now I have this diagram for you, and I want us to take it together. Okay. So over here, we have our liver, all right? Now, LDL, low density lipoprotein, is a bus, okay? It's a bus that is carrying more cholesterol. This lipoprotein is a bus, and this lipoprotein is of low density, which means that we can fit in cholesterol inside it. We can fit in a lot of cholesterol inside it, right? So LDL, this is LDL here, this blue lipoprotein, the blue, what will I call it now? This blue ball is housing cholesterol molecules, okay? So this blue ball is a lipoprotein, and this lipoprotein is of low density, so it can carry 4 molecules of cholesterol, just as an example, okay? And over here, if you follow my pointer, we have the HDL lipoprotein. So this HDL is a bus, a high density bus that can't carry much. So it will carry only 2 molecules of cholesterol because it has high density already. Okay. Now, because of our biased view of cholesterol, when we see that LDL carries more cholesterol, we say that it is bad, right? Because we already think of cholesterol as bad. So anything that is carrying more cholesterol, that thing is already bad. Okay, that lipoprotein is already bad. And when we see that, okay, HDL carries less cholesterol, we then call it good. Okay, because the bus that has the fewer amounts of cholesterol should be considered better, right? And that's simply how we got this view of LDL is bad, HDL is good, okay? However, it is not LDL or HDL cholesterol. You can see they are just doing their job, okay? LDL carries more, not because LDL is bad, but because it has more space, okay? And HDL carries less, not because HDL is a saint or an angel, but it just carries less cholesterol, okay? So it's not about LDL or HDL we should look out for, but the balance and the health of the cholesterol that is inside, okay? That is what we are going to talk about today. It's the same cholesterol, all right? It's the same cholesterol inside the bus. The same cholesterol that is inside LDL, lipoprotein, is the same cholesterol that is inside HDL lipoprotein. All right, so let's get that clear. Nothing changes in the cholesterol. Okay, so when your LDL is high, it simply means that your liver has released it to be used by your body. Now let's follow my graph. We have your liver, a very happy liver functioning well. So the liver says, okay, today we're going to release some cholesterol. We need some cholesterol to work to repair some muscle cells. Some cells have died in our muscles, and we are going to release some cholesterol so that we can fix that, we can repair that, we can generate new cells, all right? Remember yesterday, we said that cholesterol is one of the major components of a cell, okay? So your LDL will release 3 LDL. Your liver will release 3 LDL, and those 3 LDL each contain their own cholesterol. and then it goes into the cell. You know, this cell is the basic unit of your muscles and your skin. It's the basic unit of your kidney. You know, every tissue, every organ in your body is made up of a cell. All right. So your liver would produce this cholesterol, and then your cell would make use of it. Maybe it would use, let's say, 2 of this LDL just as an example, and then it has to return the other one back. All right. It has to return it back to the liver. So in order to return it back to the liver, it's going to go out in an HDL lipoprotein, because it has used the amount of cholesterol it's releasing is not as high anymore. All right. So it's going to just remove small, just give the little that it did not use back to the liver. All right. And that's why we see that HDL only carries 2 cholesterol. So when your LDL is high, it simply means that your liver has released it to be used by the body. And this usage includes healing, repair, production, protection of your cells. All right. So I hope that we understand now, I hope that this gives us, a visual representation of LDL and HDL, so that you know that it's not LDL being bad. They are just doing their job. When it's coming out of your liver, it is LDL. When it is going back into your liver, it is HDL. All right. So I hope that we understand this. Okay. Now, let's focus on the LDL. Remember, I said it's not by the boss. It's not by the lipoprotein. What determines whether your cholesterol is good or bad is not whether it is in the LDL bus or it is in the HDL bus. What determines if it is good and healthy is by the balance and the size of this cholesterol. Okay. Now, when your LDL is large, okay, when your liver releases this LDL cholesterol, when your liver releases some LDL cholesterol, on its way to the cell, as it's passing through the bloodstream, it's not going to fly there, right? It has to pass through the blood to get to the cell that needs it, right? So on its way, it is traveling on the road, it is traveling on the inside the blood, it's moving. All of a sudden, it comes in contact with oxidative stress. It gets jammed with your excess blood sugar that is in the blood, okay? And then it shrinks, it gets small, right? Now, when it gets small, it gets damaged. When it comes in contact with that sugar, when it comes in contact with that oxidative stress, that chemical reaction that's not balanced, when it comes in contact with it, it gets small, it gets damaged, all right? Now, what damages it? Like I've said, oxidative stress, sugar, toxins, inflammation, excess free radicals, okay? Now, your liver senses that, okay, this cholesterol can no longer be used by the body anymore. This cell can no longer use a damaged LDL, right? It wouldn't be good for the cell. So it sends, a signal back to your liver, hey, this LDL you gave me, it's damaged though. What's going on? Recycle it for me, okay? Now, as the LDL is traveling back again, it's already damaged now. As it's traveling back again, going back to the liver, your liver cannot accept it, okay? Because the receptors are not able to hold on to it as it would if it were still healthy. Now, I have 3 healthy LDL cholesterols here, okay? You can see they are of optimal weight. They are fluffy, they are large, very healthy, okay? And it has to fit exactly onto this receptor so that your liver would then open its mouth and swallow all the LDL cholesterol. If it doesn't fit into this receptor, sorry, my throat. If it doesn't fit into this receptor, your liver will not accept it anymore. Okay, you can see here this smaller LDL, it's already damaged and it doesn't fit in. So your liver is not going to open its mouth and take back that LDL. That's damaged LDL. So big LDL, healthy ones, can enter the liver. The smaller ones that are already damaged because they have come in contact with sugar, toxins, oxidative stress, excess free radicals, inflammation, and the likes of them, it can no longer enter into the liver. All right. Okay. Now, how do your statin medications work? What your statins do is that they would increase the number of teeth on your liver. Okay, you can see now the number of receptors on this liver has increased. Before we had only 4 receptors. Now, when you take your cholesterol lowering medications, the number of receptors will increase. Now you have 1, 2, 3, 4, 5, 6, 7. Okay, so you added 3 more receptors. Okay, so when you're taking your drug, it increases the number of receptors, and then the function of the drug is to reduce your cholesterol, right? So it would now send it back. Okay, remember, your cholesterol has not gotten to the cell. All this is happening whilst your cholesterol is just trying to make its way back to your cell, okay, to your muscle cell, to your kidney cell, etc. Now, when you take that cholesterol, when you go for a blood test, oh my God, your cholesterol is high. You have to take a medication. The doctor gives you a medication, and then you take it. It will increase the receptors on your liver and send it back to your liver. Okay, good and fine. The good ones will get accepted. Okay, but when the liver first released this LDL cholesterol, when the liver first released it, everything was okay until some of them got in contact with sugar and toxins and high carbohydrate foods and processed foods and all of that. Now it is damaged. Now, when you take that statin and it is sending all your cholesterol back into the liver, all of them are not going to go in because some of them are now damaged, and your liver cannot accept damaged LDL anymore. All right, you can see now that it's smaller. It's not going to fit into this receptor anymore. It has to fit directly. Okay, so please pardon my drawing. I know that I didn't, get it right. Like the receptors, not everything is capturing well, but you get what I mean. Okay, you can see that it's smaller and it won't fit into this receptor. So the liver would not open the teeth. Okay, so the bad ones will still roam about your bloodstream. Okay. Now, statin would reduce your overall cholesterol, but it does not reduce the number of this damaged cholesterol you have here. Okay, this damaged cholesterol remains the same. Other ones that your body needs, these healthy fat ones that your body needs, that was making its way to your cells, it doesn't get there anymore. Okay, your statin medication sends it back. Okay. And the damaged ones, it sends everything back, all right? But because the damaged ones can no longer enter into the liver, it just stays in the bloodstream. It just roams about, okay? And this is the reason, because your statin medications do not reduce your damaged cholesterol, this is the reason people will still suffer from strokes, and people will still suffer from heart disease, and people will still suffer from heart attacks and coronary artery disease, because this small LDL is still roaming about in the bloodstream. So this is a blood vessel, right? This tiny LDL is just roaming about. And plus, your cells don't have the cholesterol that they need. Okay, so everything is just roaming about in the blood. And, because of oxidative stress, remember we said yesterday that oxidative stress would cause, the wall of your blood vessel to open up, to it will give it this small wounds. And because this LDL is so tiny, it will enter inside that wound. Okay, it will enter inside that injury, that opening. Okay, and then your white blood cells, your immune system, it would start to release macrophages. And the work of this macrophage is to swallow all this LDL. So it will swallow it quite all right. Okay, it will swallow it quite all right. But then to swallow it, it has to enter inside the blood vessel. Remember, we spoke about that yesterday, right? So it has to enter that small opening inside that blood vessel to swallow all the LDL. So as it is swallowing all the LDL, it's getting fatter and fatter and fatter, okay? And then it can no longer come out through that same opening again because the size is not the same. So it just stays there. And that's what we refer to as your plaque, all right? So now we can have a little argument, right? We can just have a little argument and say, well, at least when I take the statin medication, at least when the LDL goes back, the chances of all the LDL getting oxidized is reduced, right? So if your liver sends back all these LDL, okay, at least the number of LDL that will be oxidized and get smaller is reduced. The chances of them getting oxidized is reduced. But then your body needed it. That's why your liver released it in the first place. You needed it for repair. You needed it for healing, for protection, okay? And your liver released it, but then because of these statins, you've sent it back now, okay? And now let us also bear in mind that it's not about the number of LDL that you have. The danger is in the oxidized ones, okay? Because that's what will sink into your blood vessel and create a plaque, right? So it's not about the number of LDL. It's not about the number of this healthy cholesterol. It's not about this. It's not about how much your liver releases this LDL cholesterol. Okay, that's not it. What matters is these damaged ones. How many is it? Okay, so it's about the ratio of the unbalanced ones, the unhealthy LDL to the healthy LDL. Okay, so do we understand what I've said so far? Please let me know. Do we now understand that LDL cholesterol is not bad cholesterol? It's just doing its job. The same as HDL, it's not a saint, it's just doing its job as well. You know, and do we now see that it's because of the oxidation of this LDL while it is still making its way to the cell that, you know, it gets oxidized and it gets damaged. And then because of that damage, it's just roaming about in the bloodstream, and then it would then form a plaque, okay? So before I move on, can you let me know, please? Are we together? Do you understand what I've said so far? Does this clear up whether LDL is good or bad, whether HDL is good or bad? Okay, please let me know. Please type using the chat, okay? Okay, all right. I'm happy that we are following and we understand, okay? Mr. Franklin says LDL is good. Okay. All right. So I want us now to take a look at a blood work. Let's take a look at a blood test. Okay. Let's take a look at a blood test. Let us know what to look out for. Let's know if your cholesterol is unbalanced or not, because now it's not about LDL and HDL. Okay. It's not about how much LDL do you have. LDL is needed in your body, and LDL, you know, the way we look at it is not how it really is, okay? So it's not about, oh, is your LDL high? Is your LDL low? Is your HDL high? Is your HDL low? That's not what we should focus on. What we should focus on now is your cholesterol balanced? The ratio of your oxidized cholesterol, the smaller ones, and the healthy ones, is it balanced? Okay, we will see that we cannot make a diagnosis and we cannot recommend a drug only when LDL or total cholesterol is high. We need to take a look at all the markers, okay? Because when you take a blood test and you see that, you know, your cholesterol is high. So you can have a very, very good blood test, but because your total cholesterol is high, the doctor will give you a statin medication. So I want us to take a look at a lipid profile. Let me show you now that you don't need to take a cholesterol medication simply because your LDL or total cholesterol is high. Okay. Now, there are important things to look out for in a lipid profile test. Glucose levels, insulin levels, A1C, triglycerides, VLDL, I'll explain that in a moment, HDL ratio, and blood size. These are important indicators when it comes to recommendation and diagnosis of a statin medication, okay? So before you are placed on a statin medication, your glucose has to be high, your insulin has to be high, your A1C has to be high, you need to have high triglycerides, as well as high VLDL, and you need to have low HDL. You need to have a high ratio of your total to your HDL, and we also need to take a look at your LDL size. Now, when you have high glucose, what does that mean? When you have high blood sugar, it means that your body will produce high insulin to remove that blood sugar, okay? To package that sugar and get it out of the blood, okay? And that means that you would need high insulin to do that, okay? You would need an insulin level that is higher than normal to do that. Now, even upon that high insulin, because you are insulin resistant, your blood sugar stays high for an amount of time, okay, for a period of time, okay? And that's what we call A1C. That is you having high blood sugar for quite a consecutive number of months or years, okay? Now, because of this insulin resistance, because of this high insulin, this high blood glucose, okay, your body packages the excess glucose. Your body says, okay, you know what? This sugar, we can't deal with this sugar anymore. Let's convert it into fats, okay? So your body is going to convert the excess glucose into what we call fats, a type of fats that we call triglycerides, all right? Now, when your liver, your liver will store these triglycerides so that when you need it, it would remove it, right? When your liver wants to release these triglycerides, it's going to release it in a form that we call VLDL. That's what we refer to as VLDL, okay? So let me go back to my diagram, all right? When your liver wants to release triglycerides, it's going to release it as this LDL, and then it would then add the triglyceride inside, okay? So that's what we refer to as VLDL, okay? I should have put a picture of VLDL. Maybe I should have used a green molecule, okay? So just imagine a green molecule. That green means that it has fats and cholesterol, okay? It has fats, which was initially sugar, okay? It doesn't have just cholesterol anymore. It now has fats and cholesterol. Fats and cholesterol are not the same thing. Fats and cholesterol are not the same thing, okay? Let me repeat that again. Fats and cholesterol are not the same thing, okay? So when your body wants to release this fat that was initially glucose, it is going to release it as fat and cholesterol together in a form that we call VLDL, okay? Now, your HDL has to be low. And if your HDL is low, that means that your body is not getting enough cholesterol. Remember, your liver released some cholesterol at the beginning, but it didn't get to the destination of the cell, right? So if you have a low output of HDL, okay, this is it. Where's my diagram? If your cells are releasing very, very low HDL, that means that they're not even getting enough to be able to give out more. Okay, you cannot give what you don't have. So if your cell is not giving out enough LDL as it's supposed to, that means that it's not even getting enough. Okay, I hope that we understand that. So an indicator of heart disease, or if you are looking at a lipid profile test, that LDL has to be low to tell you that there's something wrong, okay? And then if you have a high ratio of total cholesterol to HDL, then that's not good as well, all right? And your LDL size, okay? Remember, the size is important because when the size is small, it means that it is damaged. When the size is big and fluffy like this one's here, it means that it is healthy, okay? So we have to take a look at the size as well. We have to consider all of these things and not just total cholesterol, not just LDL alone to place a human being on a statin medication. All right. Now let's take a look at this table I have put together here for us. All right. Now this is somebody's blood test. This is somebody's lipid profile test. Okay. Now let us start with glucose. All right. Your glucose has to be lower than 65. Sorry, it has to be within the ranges of 65 to 100. That's a healthy glucose level. All of the units I'll be mentioning are milligram per deciliter, okay? So your blood glucose has to be within the ranges of 65 to 100, okay? If it's above 100, that means that you may, emphasis on the word may, be pre-diabetic, all right? And if your glucose is lower than 65, it may indicate that you have hypoglycemia, which is low blood sugar, okay? Emphasis on may. So this person here, we can give the person a name. Okay, let's use my name. Let's say Rita. Rita has a glucose level of 74 milligram per deciliter. The reference says it should be between 65 to 100. So Rita is good to go. Rita has a good glucose level, okay? We all agree on that, right? Okay. The next marker is total cholesterol. If your cholesterol is 100, the marker says this cholesterol should be between 100 and 199. If your cholesterol is 100, if you ever take a blood test and your cholesterol is 100, you are not healthy at all. Even the doctors will tell you that you have very, very low cholesterol, okay? But the marker says it should be between 100 to 199, no problem, all right? We accept that, okay? But Rita has a total cholesterol of 278 milligram per deciliter. This means that Rita has high cholesterol, all right? All of these reference points I'm using here are real reference points, okay? All right, now let's move on. Rita has high total cholesterol. Let's keep that aside. What about triglycerides? Now, how do we come up with triglycerides? Remember, you would only have high triglycerides when you consume excess carbohydrates, too much sugar, and then the excess is turned into triglycerides, okay? All right, and the reference says this excess sugar turned into triglycerides, it should be between 0 to 149. A human being's triglyceride cannot be 0. If it were 0, that person is a dead human being, okay? But the marker says it should be 0 to 149, okay? No problem. 149 is way, way, way too high for a triglyceride level. If your triglyceride is 149 and above, then it means that you have excess triglycerides. That means that you are storing so much sugar as fats, okay? And for you to have excess fats, for you to have excess triglycerides, it means that your sugar is excess, right? So Rita's triglyceride level is 65. Good. It's not high. It's not even up to 100. So that means that Rita has low sugar being stored as fats. Okay. That means that Rita's sugar is optimal and she uses her sugar. Her body doesn't need to store excess upon excess as triglycerides. Okay. So I hope that we understand that. Now, VLDL. Okay, when the excess sugar is stored as triglycerides, okay, and for some reason Rita is fasting, okay, Rita decides to fast. Now, Rita has used all the sugar in her bloodstream, and it's time for the liver to produce, to release some of this stored glucose that it has stored as triglycerides, right? Now, what is the liver? The liver needs a lipoprotein for that, okay? So it's going to use LDL, okay? And it's going to put the fats inside the LDL that we now call VLDL, okay? So VLDL means triglyceride plus that LDL molecule, okay? Triglyceride meaning excess fats, excess sugar stored as fats, okay? Now, the work of this VLDL is to give it to the cells. Rita there's no more sugar in the blood. Please release some of these, please release some of your storage, okay? So the work of this VLDL is to offload it to the cells, okay? So if Rita is insulin resistant, if Rita is struggling with prediabetes, her cells are not going to respond to this VLDL because they are already full, okay? But by this test, Rita is not insulin resistant, okay? So her body is going to respond to the VLDL. Her body is going to make use of VLDL, which means that VLDL is going to be low. And that's why you see that Rita's VLDL test comes out as 10. And the reference should be 5 to 40, okay? Now, 40 is too high for normal. If your VLDL is higher than 20, you are a pre-diabetic patient. That means that the VLDL is high. That is, if it's higher than 20, not even 40, it means that your cells don't need the storage yet because they are already full of glucose. I hope that we understand, okay? If your VLDL is high, it means that your cells don't need the storage yet because it is already full of glucose. It's already full of sugar, okay? So the VLDL just sort of, remains in the blood, and then you take a blood test and it marks that your VLDL is high. If it's higher than 20, that's higher than normal, okay? But then again, so many people are insulin resistant these days and nobody wants to scare anybody. So the upper point is 40. No problem. We move on. All right. Now, LDL. Okay. The reference says our LDL should be 0 to 99. Okay. Again, your cholesterol, LDL, we have now seen that LDL is not bad, even though as I'm saying LDL, so people might still see it as bad, okay? But we have known the truth now that LDL is just a lipoprotein. LDL is just carrying cholesterol, all right? Now, your LDL can never be 0. If it were 0, you would be dead, okay? And 180, okay, your LDL cannot be 0, okay? Higher than 99 is way, way, way too low, all right? Depending on your body's need for cholesterol. Rita needs this cholesterol, okay? Cholesterol is an essential nutrient in the body. We use it for so many things. This 99 is way too low for an LDL, but because of the fear of LDL cholesterol, no problem, okay? We leave it at 0 to 99. Now, Rita has taken her blood test, and Rita's LDL comes out as 215, okay? So the scanner has detected it as too high, okay? The one I marked in red means that it is too high, okay? All right, now HDL, everybody already knows that HDL is good, or everybody sees HDL as good, all right? But HDL simply tells you that your body has enough cholesterol. Your body is using enough cholesterol and it is returning back, some cholesterol back to the liver. All right. So Rita's LDL, the scanner says, the reference point says it should be greater than 39, and Rita's HDL is 46. Okay. So that's a good HDL level. Okay. It means that Rita is actually making use of this high LDL. okay, for the body to return back 46. It means that 215 minus 46, I don't know out of the top of my head, but it means that at least a huge chunk, at least more than 50% of the LDL that was released is being used for 46 molecules to be returned back. All right, I hope that we understand what I just said. Okay, so for Rita's LDL to be greater than 39, it means that Rita has good HDL levels. All right, now ratio of total cholesterol to HDL is 3.5. The reference point says it should be between 0 to 5.0. Again, it can never be 0 unless you are 6 feet. Okay, but thank God Rita is not 6 feet. Rita's total ratio is 3.5. So that's very, very good. All right. So out of this, before we go on to the NMR profile, okay, before we go on to the NMR profile, when you see this blood test, you see that the only two things that are marked as high is cholesterol. And if I go to the doctor with this blood test, you bet they will put me on statin medications. The reason being, your cholesterol is too high. You need to be on cholesterol lowering medications. But if you look at all the markers here, okay, especially those that are true indicators of heart disease, which are glucose, triglycerides, VLDL. Those are the things that tell you of your insulin resistance. And that insulin resistance is one of the reasons you have oxidative stress. And that's a true marker of heart disease. Okay? All these other markers are good. 5 out of 7. 1, 2, 3, 4, 5, 6, 7. 5 out of 7 are good. Rita is very healthy. And the level of cholesterol Rita has is what her body needs to have, because cholesterol is an essential nutrient. Okay. But if you go to the hospital, if I go to the hospital with this, they will place me on cholesterol lowering medications because they have seen that my cholesterol is higher than the reference points. This cholesterol before, the reference point would be 300. If it were before, Rita has a healthy cholesterol. But now that the numbers are reduced, the reference numbers are reduced, it is seen as Rita has a bad, number of cholesterol. Okay. Now, if we say, okay, let's go further. Let us really, 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 really find out if Rita is healthy by taking a look at the health of Rita's LDL cholesterol. Okay, let's say I tell the doctor, no, my triglyceride level is good, my glucose level is good, my VLDL is good, my HDL is good, my ratio is good. You need to show me more proof that I need to be on statin medications. And they say, okay, take an NMR profile. That would then tell us the health. Let us dive into the cholesterol. Let us know if the cholesterol is actually healthy. And how do we know? Is by the size. Okay. Hello. Hello, everyone. Can you hear me? I was thrown off. Hello, can you hear me? Okay. So I was explaining that I don't know where you lost me. I don't know where you lost me. But the last thing I said was, if I debate with the doctor saying my glucose is good, my triglycerides are good, my VLDL is good, my HDL is good, my ratio is good as well. It's just that my total cholesterol and LDL is reading that it is high, right? You need to show me more proof that this cholesterol is terrible, that this number of cholesterol is terrible. okay? And how do we know if the cholesterol is bad or not? Okay, we have to take a look at the cholesterol. So I will then demand for an NMR profile, okay? To know, let us examine my cholesterol. Let us know if truly all of my cholesterol is good. Let us know how many of them are oxidized, how many of them are good. All right, because as I am trying to explain to you, LDL is simply a boss. LDL is not bad. LDL is simply a boss. Okay, so let's take a look at inside the bus. Let us know the content of this bus. Is it all healthy? All right, so I would take a lipid, an NMR profile. Okay, now LDL particle number, that is the number of cholesterol molecules inside that LDL. All right, they say that it is supposed to be less than 1,000, but Rita has more. Rita has more than 1,000. Rita has 2,291. Okay. Now, within that 2,291, small LDL, damaged LDL, is 212. While the reference point says that the damaged LDL should be 527 or lower. Okay. Now, this means that they think it is okay that you have more than half of your LDL be small and damaged. Out of 1,000, this LDL ball, okay? Out of 1,000 of these yellow balls, okay? Out of 1,000 of this LDL that is being released, it means that you should have more than 50% be damaged. That's what the reference point says. But Rita has only 9% of total LDL damaged, only 7%. Okay, so if you really want to know if your LDL or your total cholesterol, if it is really bad for you, you can take this NMR profile test to let you know the number that you have and then how many in that number are damaged. All right, so just looking at this test, I would be definitely giving, in fact, 2 or 3 starting medications because my cholesterol levels are high. But now that we have a better understanding that cholesterol is not bad, that cholesterol, your body needs cholesterol to do certain things. And just like the recent study showed us yesterday, cholesterol is not a nutrient, it's not a concern. It's not something that you should be concerned about over consuming. Okay? Cholesterol is not a cause of concern. So now that I've taken a look at my lipid profile, okay, my NMR profile, and I see that out of my total cholesterol, only 7 are damaged. That is good news, as opposed to the 53% that they actually want to see being damaged. I don't know if... Hello, everyone. Can you hear me? My internet is pretty shaky. Hello? Can you hear me now? And can you see my screen? I'm so sorry. I've had very poor internet today. can you please confirm? Can you see my screen? Okay. All right. So I was explaining that in order for us to know if Rita's total cholesterol, to know the ones that are damaged, okay, and the ones that are healthy and fluffy. The ones that are healthy and fluffy, we need them. It's not a cause for alarm, whether it is high or not. That's simply your liver producing. And you can't beat this, right? You really have no control over your cholesterol. Whether you eat more or you eat less, your body will adjust accordingly. Okay, so genuinely, you have no power over it. If you eat less, if you say you want to abstain, okay, your body will produce accordingly. All right, so Rita has done an NMR profile, and now we can see that Rita has only 7% of her total cholesterol damaged. Okay, meanwhile, the reference says that it should be 53% damage. You can imagine that. Okay, that means that you should have damaged cholesterol up to the point of having half of them being damaged before you now see it as a cause for alarm. Okay, so Rita has a good test. All right, and from this test, we can now see that it's not just by looking at your LDL and saying, oh, it's bad. It's bad. Give her a cholesterol lowering medication. Okay, and then you reduce the cholesterol that the liver is producing. Okay, you reduce it, you cut it off. It doesn't get to the cell anymore. Okay, it's taken back to the liver, and then your cells start to cry. They cry by giving you all these side effects. Okay, because what they needed is not being given to them. All right. Okay, so now we know that it's not just about a blood test saying that it is higher than the reference point. If this reference point was 300, like it was back in the day, there's nothing wrong with Rita. If this reference point, if this total cholesterol was 300, as it was back in the day, then there is absolutely nothing wrong with Rita. Okay, but because of how we from yesterday's class, we've seen that if we have this myth that cholesterol is bad, okay, we want to reduce it and cut it off as much as possible. Okay, and our body starts to beg for mercy. All right, now let's move on. Does dietary fats equal cholesterol? Your fats and your cholesterol are not the same thing, but your fat definitely increases your cholesterol. Okay, fats and cholesterol are not the same thing. All right, but it definitely increases the cholesterol level. Okay, so yes, it is true. Okay, a high fat diet means that you are getting all the fats. Okay, a high fat diet means that you are eating high saturated fats, you are eating high unsaturated fats as well. Okay, and when you eat a high fat diet, what is being put into your body system is the healthy form. Okay, so how did we now arrive at saturated fats being bad and unsaturated fats being healthy? How did we get here? How did we then, what happened that we demarcated the two? If all the fats that we eat is healthy, fluffy cholesterol, okay, if all of them are healthy, how come we now have this demarcation between the two? Now, the cholesterol that you have in your meats, the cholesterol you have in your eggs and other foods, it's highly pure cholesterol until you process it. Okay, and when some of that pure cholesterol is being processed, it turns into oxycholesterol. Oxycholesterol simply meaning cholesterol now plus oxidative stress, okay, which you should have gotten inside your body, but now you are getting it from your mouth. Usually you eat pure cholesterol from your mouth, and then if you are not healthy, the cholesterol will not get oxidized, and then it's bad for you. But now that it is processed, you are eating poison already from your mouth. Okay, now examples of these processed foods are your fried foods, your seed oils, your vegetable oils, powdered milk, spray-dried eggs. So it depends on how you cook your food and how you consume your food. All right. when you process these foods, they get changed. It gets turned into oxycholesterol. All right. And unsaturated fats, that's the reason we say saturated fats is bad, because most of our saturated fat foods, we have to cook them and we have to process them, like your corned beef and you know, etc. when it comes to meat. Okay. And your milk is no longer pure. You have to process it. You know, majorly your saturated fats are processed foods. Okay. They have undergone some form of processing. But your unsaturated fats, it rarely ever gets processed. And because of this, which is less processed and which ones are highly processed, which ones are highly cooked and which ones are highly heated and all whatnot, we then have the assumption that, okay, saturated fats are bad, unsaturated fats are good. Now, even if you consume pure cholesterol, if you consume saturated fats in a pure way, in a healthy way, okay, and you know, it is good for you as it gets into your mouth, it can still turn into oxycholesterol if you are not observing healthy lifestyle practices, because then that cholesterol will come in contact with oxidative stress. All right, so let's move on. What damages the cholesterol after you put it in your mouth? So let's assume you want to consume saturated fats. You want to consume your meats, okay? And you know, you don't put your meat and your milk and your eggs, you know, through dangerous processing, which many of you actually do not. Okay, many of you do not. All right, you simply cook your meat well. Okay, but when you eat things like corned beef and sausage rolls and fast foods and hamburgers and fried foods and all those things, then it becomes processed. All right. Now, what happens when you eat the pure one and then it causes you harm? It means that that cholesterol that you have consumed, yes, it was pure, but it has now come in contact with oxidative stress. Okay. Also, when you eat these cholesterol foods that are pure, let's say you eat your egg now. All right. Let's assume you eat egg and then you consume 1 can of Fanta. Egg, boiled egg, your normal boiled egg, pure cholesterol, good for you. That can of Fanta, I don't even remember how many cubes of sugar they say is in one bottle of soda. Okay, but I don't need to tell you that it's not good for you. I don't need to tell you that if you remove that sugar and put it in cubes, you won't be able to consume it. Okay, but you can drink it in one sitting because it is Fanta or Coke. Okay, now if you consume that egg, when that egg finally gets into your system and you drink that Fanta, the cholesterol from the egg gets in contact with the sugar from the Fanta. It gets oxidized. Do you understand it now? And then you would then be told that you should keep away from egg. Egg increases cholesterol. It's not about cholesterol anymore. We have already established, if you want to believe that cholesterol is actually healthy for you, it's not about cholesterol anymore. What type of cholesterol? And it's not HDL and LDL. HDL and LDL, they are simply transportation methods. Simply transportation methods. LDL simply means it's coming out of your liver. HDL simply means it's going back into your liver. You know if your cholesterol is healthy or not, depending on whether it has come in contact with processed foods, toxins, oxidative stress, inflammation. Not about LDL is good, LDL is bad. Okay? So this is what would make all these pure cholesterol foods that you may be consuming, like your meat, your eggs, okay? That's what makes them to be bad. Not necessarily that they are bad in themselves, okay? It's depending on your body's health, okay? Your body's health. Now, let's compare carbohydrates and fats, okay? If I tell you you should take a high fat diet, some of you may say my doctor doesn't agree with a high fat diet because high fats would lead to cholesterol. Now let's talk about it. Let's compare the two. Yes, fat will definitely increase your cholesterol levels, okay? But fat in itself is a macronutrient. It means that It's not something your body can do without. Your body cannot do without fats. Okay? And that's the primary source of fuel. That's your body's best form of fuel, fats. If your body could use anything for energy, it would make use of fat first. Okay? Fat doesn't raise insulin. If it doesn't raise insulin, then it cannot lead to inflammation and insulin resistance. Please, if you haven't been listening, this is the time when you should listen very well. Fats does not raise insulin and inflammation. It does not increase oxidative stress because your body would make use of it. Your body knows what to do with it. It is when you start to consume things like carbohydrates, even though, yes, in the absence of carbs, in the absence of fat, sorry, your body would then make use of carbohydrates as a source of energy. Only when you are absent from fats, okay? Your body will begin to make use of carbohydrates, and you already consume excess carbohydrates. And carbohydrates, because it is your body's secondary source of fuel, which means that, you know what secondary means? It's not supposed to be, but in the absence of A, you will use B, right? Now, when you begin to turn B into A, problem starts, okay? It raises insulin. It leads to inflammation and oxidative stress when you excessively consume it. When you try to replace your fats with your carbohydrates. When you try to do the work of fats with carbohydrates. Okay? So if you consume high saturated fats and you eventually consume high carbohydrates, you will eventually damage your LDL. You will eventually damage your healthy cholesterol. You would oxidize it by your high carbohydrate foods. So if you eat high saturated fats and your total cholesterol increases, what you should be concerned about is not whether your cholesterol is increasing or not, but what percentage of my cholesterol is damaged. Okay? Because once it is damaged, your liver can no longer accept it. Your liver can no longer take it back. It is now an outcast. And it will go and start looking for where it is not supposed to be. It will start finding room in your blood vessels, developing plaque. All right? Okay. Now, moving forward, what do you need to do? Cut down on your carbs to reduce your insulin, to reduce your insulin resistance, reduce your oxidative stress. Eat more fatty food so that your body can return to its primary source of energy, its primary source of fuel. Okay? Less fast food, less processed foods, less sugar, less fructose, and also practice intermittent fasting. All right? Your total cholesterol will increase. Yes, it will increase when you eat foods that are high in fats. Okay? But then, is cholesterol bad? Is cholesterol bad? Is cholesterol a cause of concern? The answer is no. What you should be concerned about is inside that cholesterol, how many of them are damaged? Okay, so by following this 5 bullet points I have here, you lower your insulin resistance, you lower your VLDL, and you lower how much your body needs to store excess sugar as a form of fats. All right. Now, can I consume red meat? Rita, what you are saying now is quite controversial because I've been hearing all my life that red meat is not healthy for me. Okay. Can I still consume red meat now that we are talking about saturated fats or saturated fats not being so bad as we think it to be? Okay. You can consume your red meats because now we understand why we villainized saturated fats in the past. Okay. Now, for those of you who are already suffering from oxidative stress, someone like me, I'm not in the same health condition as you are. So I can't consume my red meats. Okay. But you that is hypertensive and diabetic, okay, when you eat red meats and it increases your blood pressure, not because of the cholesterol that you are getting from the red meats now, but because of your oxidative stress, because of the state of your health, it is damaging that cholesterol that you are consuming. And once it damages it, it cannot be used again by your body or your liver. So it just roams about in your bloodstream. Okay. So whilst you are working on yourself, that has oxidative stress and is dealing with inflammation, as you are working on yourself at this point in time, the best advice I can give you is to abstain from it so that it doesn't just, destroy your cholesterol that you are getting from your red meats. Okay, it doesn't just put it off instantly because of the state of your health. Work on your health, improve your immune system, manage oxidative stress. Then when your cholesterol levels are, when your inflammation and your insulin resistance and your oxidative stress have reduced, you can then consume red meat, and then the cholesterol that you get from it would not be damaged once you consume it. Okay, so I hope that this is also clear. Now, Rita, in everything that you have said, I still fear this cholesterol. Rita, this class that you've done since yesterday, it's nice. I like it. Good job. But see, I still want to lower my cholesterol. Okay? You cannot do that via your food and exercising. Cholesterol or not fat. Remember I said cholesterol and fat are not the same thing. But fat will lead to an increase in cholesterol because your body would use that fat to produce cholesterol. Rita, in everything that you are saying, I still want to lower my cholesterol levels. Okay? I still want to get them down. You can only do so much with your diet. If you really, 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 really want to lower your cholesterol, then you have to get on medications. That's the only effective way for you to lower your cholesterol numbers. Because if you eat less cholesterol, your body will make more. And if you eat more, your body will create less. So you cannot escape cholesterol. Okay? Now, when should I worry about my total cholesterol levels? I have seen the example of the blood test that you have shown us, but when it's too high? When is my cholesterol now too high? Okay, now not my words, okay, but according to Dr. Youth, your cholesterol is high, or it should be a cause of concern for you when it is higher than 350. And not just higher than 350, when it is higher than 350 and you have gained weight, your glucose is high, your A1C is high, your insulin is high, triglycerides are high, HDL is low, small LDL is high, VLDL is high, you have poor sleep, and you're having muscle pains. That's when you should now think about, okay, something is not right somewhere. Okay? All right, I hope that is clear. Let's stop making diagnosis using only one marker alone. The other markers are there for what? Why do we just overlook them, even when they are healthy? Why do we just overlook them like it's nothing? Like it doesn't take anything for you to just train your body to have a healthy glucose. You know what it means for your glucose to be healthy? It means that you are working on your health. For your triglycerides, especially, to be healthy, it means that you are not storing excess sugar as most people do. For your VLDL to be healthy, it means that you are doing a good job. So why do we just throw it in the bin because cholesterol is high? Because we have demonized cholesterol, okay? And I hope that by this session, things have turned around. You have a better understanding now, okay? And if you still tell me, Rita, I'm still afraid high cholesterol may lead to heart disease. It may lead to heart attack. Rita, I'm still afraid that my cholesterol levels, I'm not convinced. And honestly, I don't blame you, okay? It's understandable. If you still see high cholesterol to be a cause of heart disease and you want to know if you are safe, there is a way that you can measure your plaque, okay? By getting what we call a CAC test. That is an imaging of your coronary artery. Get a picture of it. I mean, how best should we know if you have plaque than taking a picture of the blood vessel? Let's know if you actually have the plaque or not. Okay, and when you see that your cholesterol is high, and you actually don't have that plaque, you would be at peace, right? So go and take a CAC test. It would let you know, if your coronary artery is at risk for heart disease. And then you can come back to this slide to then check if your numbers are within these ranges. Okay. And then you track it. All right. 0 means you have very little to no plaque. 1 to 10 means you have very minimal plaque. 11 to 100 means you have a mild plaque. There's a little bit of growth of that plaque in your blood vessel. Okay. But your risk of heart disease is not a cause for alarm yet. 100 to 400 is moderate, and you have a moderate risk of heart attack. And then greater than 400, it's large, and you would suffer a heart attack within the next 5 years. So when you take your CAC test, come back to this recording or just take a screenshot of it and know if you are at risk or not. And then again, please remember, all of this simply starts with oxidative stress. And what causes oxidative stress? Inflammation, sugar, toxins, processed foods. What would handle your oxidative stress is antioxidants. And the first recommendation is CoQ10. If you cannot get CoQ10, I have astaxanthin here for you, and that is 800 times stronger than CoQ10. So this is what is going to help you manage that oxidative stress, so that even when you consume foods that are high in cholesterol, you won't just damage them because of your high oxidative stress level. Okay. And I didn't forget about homocysteine as well. Homocysteine would only come up when you are lacking in B vitamins and folic acid. Okay. So prevent that by having a good intake of your B vitamins and folic acid with your multivitamin. Okay. So the major basis of all of this is simply good health. Simply good health, taking care of your immune system, because as you pay attention to your immune system and it is up to par, okay, you wouldn't have to deal with so much. And you wouldn't have to deal with the side effects of your medication so much as well. Okay. So if you don't want to get astaxanthin separate and homocysteines and your B vitamin separate, you can just have everything in your wellness pack and you are good to go. All right. So it's time for questions now. Kindly ask me your questions. Okay. And also comments as well. I would really like to know your comments about the class. Okay. It really, really helps me. So questions, please, and comments, please. Thank you. Is fructose and natural sugar from fruits the same thing? Yes, it is the same thing. In the name fructose, it's the same thing. Okay. But in composition, it's not the same thing. Okay. The fructose that you get from your sugar, the fructose that you get from your fruits and the fructose that you get from your table sugar are vastly different in terms of composition. All right. So in the name, yes, fructose. Okay. But in composition, it is not the same thing. Okay. If you begin to look at the what makes up fructose in the in the fruits and what makes up fructose in the sugar, they are vastly different. All right. Okay. Thank you, Deaconess. Thank you. All right. So what do you think about the class? I hope that I answered most of your questions, even from the slides, So please let me know your thoughts, comments, questions. And if you have none, we are done. Okay. Thank you, Mr. Franklin. Thank you, Mr. Ken. All right. No problem, Mr. Franklin. Questions, comments? If there are no questions, that means I have battled all of your questions from the slides. Mr. Jerry says, is there any connection between cholesterol and insulin deficiency? No. No. That is, would cholesterol cause you to be low on insulin? For you to be low on insulin is a whole different ball game. Okay? If you are low in insulin, if your body does not produce enough insulin, that's actually a genetic disorder. So you would only see very, very low insulin when we are talking about type 1 diabetes. Okay? So to answer your question, no, there is no relationship between cholesterol and you being low on insulin. Okay? Insulin deficiency is something that is genetic. It's an immune disorder. All right? What are the best medications to reduce cholesterol? May I say that you speak to your doctor about it, okay? I don't recommend medications. All right, Mr. Ken. So if you feel like, you want to reduce your cholesterol, you can talk to your doctor about it for the best kind of medications to take, okay? You're welcome, Mr. Kennedy. Thank you. And Mr. Victor, thank you as well. You're always on my live sessions. We're here yesterday. You are here again today. I appreciate your presence, okay? So Franklin says, is there a particular color of the eye indicative of cholesterol presence? Is there a particular color? I don't understand, sir. Is a particular color of the eye indicative of cholesterol presence? No. Okay, that is, you want to tell if you have high cholesterol with your eyes? No. Not that I know of anyway, if I should put it that way. Not that I know of anyway. Cholesterol is not a cause of concern. Cholesterol is not a nutrient of concern. Mrs. Grace says, I need more explanation on triglyceride and VLDL. Okay, Mrs. Grace, I have spent quite some time. Okay, I've spent quite some time here. So do you mind sending me a private message on WhatsApp? Okay, and I would explain to you. And I would explain to you using a voice note, okay? Mr. Kent says, what causes constant sleeplessness? So many different things can cause you not to sleep well. So many different things. So many. Okay? But if we're talking about, okay, what are the main causes? The first thing is you should look at your stress level. All right? Take a look at your stress level. But so many things can cause you not to sleep well at night. Sleep apnea, diabetes, even your medications, so many different things. And overactive thyroid can also be one of the causes. Neuropathy can be one of the causes. Okay? There are so many different things, so many that can cause you to not sleep well at night. So I would say it is better to find out what you are struggling with first. Okay? Manage that and then see if your sleep improves. Okay? Okay. Mr. Franklin says good response, but that's a way of telling in the UK. Oh, I didn't know that you can tell if you have high cholesterol from your eyes. That's interesting. Okay. Any other questions or comments? Questions, comments? Questions and comments, okay? And if there are no more, we can leave. Okay. Something a bit connected is ofada rice a safe grain or carb? Rice itself is a grain, but it's also a carb, but then not as your regular white rice. Okay, simply because it contains more fiber than your normal white rice. Okay, and it can help. So if you say, okay, what are better options for rice? Okay, ofada rice would be not my first bet, but we can say it's a healthier version. Okay, because when it comes to processing rice and getting rid of the coating and the bran and all of those outer layers that they try to remove before you then see the white grain, ofada rice stops in between somewhere. Okay, it contains more fiber. Okay, so it won't be my first bet when it comes to what's the healthiest form of rice. Okay, but it is one of the things, one of them. Okay. Okay. Is brown sugar in the category of sugar to avoid in our daily meals? Brown sugar there is no difference between your brown sugar and your white sugar. Okay. There is zero difference between your brown sugar and your white sugar. All right. Any more questions? Excellent answer. Sugar is processed. Okay. So what can be used to improve the taste of your meals? Taste of your meals. First off, your salts, okay? If you can get low sodium salts, the better. But then watching your intake of salts, limiting it to only 1 teaspoon per day. That's the first way to go, okay? And then you consider low sodium salts. And honestly, the thing with sugar is that you are used to it. So if you ever taste anything without sugar, it tastes bland because your taste buds are used to sugary foods. Okay, so it will take some time to get used to. So if you don't want to completely let go of sugar, all right, start by minimizing your intake, but I would strongly advise that you let it go. Okay, it doesn't add any benefits to your health. There is no single health benefit of sugar to you. Okay, no single benefit. So if you are still, if you can't do without it yet, start by minimizing your intake. The only reason you taste food without sugar, maybe you want to take a cereal or something, okay, and it tastes bland, is because your taste buds are used to that. Okay. All right. Okay, Deaconess says, what can be done about snoring? Snoring, first off, take a look at sleep apnea. Okay, it's one of the topics that I want to talk about. Okay, sleep apnea. That's a condition where your breathing starts and stops when you are sleeping at night. Okay, somebody else will have to tell you about that because you wouldn't know that you've stopped breathing. Okay, but it's one of the things that can cause someone to snore. Another thing again can be nasal congestion and just your position. Okay, somebody's position, the way they sleep at night. Okay, so things like raising the head of your bed can help with that nasal obstruction that will cause somebody to snore. Okay, but one of the reasons, not everybody that snores has sleep apnea. Okay, but one of the reasons people snore is because of sleep apnea. Okay, and it's also one of the reasons people are hypertensive today. Okay, so it's definitely a topic that I want to talk about, and I would in the upcoming weeks. Okay, so before we start to think about, okay, snoring is because of a disease like sleep apnea, you can try sleeping on your side, raising the head of your bed to improve nasal congestion or nasal obstruction. Okay, practicing sleep hygiene. Good sleep hygiene is also one of the things. All right. So let's start with the lifestyle. And if it doesn't work, then we can go into sleep apnea. Okay. Any healthy alternatives to sugar sweeteners? Not that I know of, Mr. Ken. Many of the sweeteners you find are artificial. And many of the sweeteners that you find, when they tell you that this thing has no sugar, it has high fructose corn syrup. Where just like this, okay, I don't want to use an example, okay, so that I don't, um, should I say, tarnish the image of the brand. But then when we say things like zero sugar, and that thing still tastes sweet, it's probably because it has high fructose corn syrup, which is even worse than sugar. Okay. And the thing about this fructose of a thing is it's only your liver that can break these things down. Okay. You are simply overworking it. So no, I don't know any healthy versions of artificial sweeteners because even if they say they have no sugar, they have a content that is worse than sugar. Okay. So if you want to go for anything, I wouldn't even recommend honey. Okay, but if you want to, all right, then you can consume your honey. Okay, you can take your honey. That is as opposed to sugar, but I wouldn't even recommend it. All right, the best thing to do when it comes to fructose and sugar is to simply let it go. And if you cannot, then you start by minimizing your intake. Okay. All right. Anything else? You're welcome, Mr. Jerry. Okay. Any other question or comments? And if there are none, am I free to go? You are welcome, Mr. Franklin. Thank you for joining me live. Thank you, Mr. Jerry, Mr. Victor, Mrs. Ajibade, Mr. Sonny, Mrs. Miriam, Mr. Charles, Deaconess, Mr. Ken, Mrs. Adenike. All right. So thank you for joining me live. Maybe I should take a break next week for hosting 2 live sessions back to back. But I will definitely inform you, ahead of time if there will be a live session next week. Okay. So please take care of yourself. Good night.